If you're a man over 40, your prostate could be sending you urgent warning signals right now that you might be dismissing as normal aging or temporary inconveniences. What I'm about to share could literally save your life, because some of these seemingly minor symptoms can indicate serious prostate problems that require immediate medical attention. Your prostate is a small, walnut-sized gland that plays a crucial role in your reproductive and urinary health. Located just below your bladder and surrounding your urethra, this gland can develop problems that range from benign enlargement to serious conditions that threaten both your quality of life and your survival. The challenge with prostate problems is that they often develop gradually, with symptoms that can be easy to ignore or attribute to other causes. Many men dismiss early warning signs as just getting older, not realizing that early detection and treatment can make the difference between simple management and life-threatening complications. Today, we're going to explore 7 critical warning signs that your prostate needs immediate attention. Some of these might surprise you because they don't seem obviously related to prostate health, but understanding these signals could help you catch problems early when they're most treatable. The first and most common warning sign is changes in your urination patterns, particularly difficulty starting urination or maintaining a steady stream. If you find yourself standing at the toilet waiting for your urine stream to begin, or if your stream starts and stops repeatedly, your prostate is likely enlarging and putting pressure on your urethra. This symptom, called hesitancy, occurs because an enlarged prostate squeezes the urethra like a clamp around a garden hose. What starts as a minor inconvenience can progressively worsen until you're unable to urinate at all, which becomes a medical emergency. Many men also notice that their urine stream becomes weaker over time, lacking the force it once had. You might find yourself standing closer to the toilet or taking much longer to empty your bladder completely. These changes often happen so gradually that you adapt to them without realizing how significantly your urinary function has declined. However, any noticeable change in your ability to start urination or maintain a normal stream warrants evaluation by a healthcare provider. The second critical warning sign is increased frequency of urination, especially at night. If you're waking up 2 or more times each night to urinate, or finding yourself needing to urinate every hour or 2 during the day, your prostate could be causing bladder irritation. Nighttime urination, called nocturia, is particularly disruptive because it affects your sleep quality and overall well-being. While occasional nighttime bathroom trips can be normal, especially if you've consumed a lot of fluids before bed, regular interruptions are a clear signal that something needs attention. During the day, you might notice that you need to urinate much more frequently than you used to, even when you haven't increased your fluid intake. This urgency can be embarrassing and inconvenient, especially when you're away from home or in meetings. Some men develop such severe urgency that they experience accidents or near accidents when they can't reach a bathroom quickly enough. This symptom can significantly impact your confidence and willingness to engage in social activities or travel. The third warning sign that demands immediate attention is the feeling that you can never completely empty your bladder. This sensation of incomplete voiding occurs because an enlarged prostate prevents your bladder from contracting effectively and pushing out all the urine. You might find yourself finishing urination only to feel like you still need to go, or you might notice that shortly after using the bathroom, you feel the urge to urinate again. This incomplete emptying can lead to urinary tract infections and, in severe cases, kidney damage. The retained urine in your bladder creates an environment where bacteria can multiply, leading to frequent infections that can be difficult to treat. Some men develop chronic urinary tract infections that require repeated courses of antibiotics. In extreme cases, the inability to empty your bladder completely can lead to a condition called urinary retention, where urine backs up into your kidneys, potentially causing permanent kidney damage. The fourth warning sign is blood in your urine, which should never be ignored regardless of how minor it seems. Blood in urine, called hematuria, can appear as bright red blood, pink-tinged urine, or dark cola-colored urine. Sometimes the blood is only visible under a microscope during routine testing, which is why regular checkups become increasingly important as you age. Any amount of blood in your urine requires immediate medical evaluation to determine the cause. While blood in urine can result from benign causes like enlarged prostate or urinary tract infections, it can also be an early sign of prostate cancer or other serious conditions. The key is that you cannot determine the cause without proper medical testing. Some men notice blood only occasionally and assume it's not serious if it goes away on its own. However, intermittent bleeding can still indicate significant problems that require investigation and treatment. The fifth critical warning sign is persistent pain or discomfort in your pelvic area, lower back, or during ejaculation. This pain might be constant or come and go, and it can range from mild discomfort to severe pain that interferes with your daily activities. Pelvic pain associated with prostate problems often feels like pressure or aching in the area between your scrotum and rectum. You might also experience pain in your lower back, hips, or upper thighs that doesn't seem related to physical activity or injury. Pain during ejaculation is particularly concerning and should prompt immediate medical evaluation. This symptom can indicate inflammation, infection, or other serious prostate conditions that require treatment. Some men also experience pain or burning during urination, which often indicates inflammation or infection in the prostate or urinary tract. This symptom should not be dismissed as a minor irritation. The sixth warning sign is changes in your sexual function, including erectile dysfunction, decreased libido, or changes in ejaculation. While sexual function naturally changes with age, sudden or significant changes can indicate prostate problems. Erectile dysfunction can be an early sign of prostate issues, especially when it occurs alongside urinary symptoms. The nerves and blood vessels that control erection run very close to the prostate, and problems with the gland can affect sexual function. You might notice changes in the volume or consistency of your ejaculate, or experience painful ejaculation. Some men notice that their orgasms feel different or less intense than before. While these symptoms can be embarrassing to discuss, they're important indicators of prostate health that can help your healthcare provider diagnose and treat problems early. The seventh and perhaps most subtle warning sign is unexplained fatigue, weight loss, or general feelings of illness. Advanced prostate problems, particularly cancer, can cause systemic symptoms that affect your overall health and energy levels. You might notice that you feel more tired than usual, even with adequate sleep, or that you're losing weight without trying. Some men experience loss of appetite, persistent low-grade fevers, or a general sense that something isn't right with their health. Bone pain, particularly in the back, hips, or ribs, can indicate that prostate cancer has spread to the bones. This type of pain is often deep and persistent, different from typical muscle or joint pain. While these symptoms can have many causes, when they occur in combination with urinary symptoms, they warrant immediate medical evaluation. If you're experiencing any combination of these warning signs, don't wait to seek medical attention. Early detection and treatment of prostate problems can prevent serious complications and preserve your quality of life. A simple blood test called PSA, along with a physical examination, can provide valuable information about your prostate health. While the PSA test isn't perfect, it's an important tool when used alongside other clinical information. Your healthcare provider might also recommend imaging studies or other tests based on your symptoms and examination findings. Modern diagnostic techniques can often detect prostate problems early when they're most treatable. Remember that many prostate problems are highly treatable when caught early. Even prostate cancer, when detected in early stages, often has excellent treatment outcomes with minimal impact on quality of life. Don't let embarrassment or fear prevent you from seeking medical attention. Healthcare providers are accustomed to discussing these symptoms and can provide compassionate, professional care to address your concerns. The most important thing you can do is pay attention to your body and take any changes seriously. Your prostate health significantly impacts your overall quality of life, and addressing problems early can help you maintain your independence, comfort, and well-being as you age. Regular checkups become increasingly important after age 40, and men with family history of prostate problems should start screening even earlier. Discuss your risk factors and screening schedule with your healthcare provider. Taking care of your prostate health isn't just about addressing current symptoms. It's about protecting your future quality of life and ensuring that you can continue to enjoy the activities and relationships that matter most to you. Don't ignore these warning signs. Your prostate is trying to tell you something important, and listening to these signals could be one of the most important health decisions you ever make.